Welcome to the award-winning AUA Leadership and Business Podcast, an official podcast of the American Urological Association.
Welcome to the AUA Leadership and Business Podcast, where urologic professionals experience the practical applications of business acumen essential for today's dynamic professional landscape. I'm Dr. Steve Riggs, and on today's episode, we will be discussing dynamic surgical leadership with Dr. Jeff Kneisl. Jeff is originally or technically from Jacksonville, Florida, and the son of a U.S. Navy aviator, moving extensively during his early years, attending 11 schools in 6 states before graduating high school. He is also a U.S. Navy veteran, attending Northwestern for undergraduate medical school and residency in orthopedic surgery, on an Armed Forces Health Profession Scholarship for medical school. Prior to going to sea, following this, he went to sea as a medical officer on the USS Vancouver, which is home ported out of San Diego, California. He's currently the Marie Claire Maroon Distinguished Chair of Orthopedic Oncology at the Levine Cancer Institute. He's Professor of Orthopedic Surgery, Executive Vice Chairman of the Atrium Health Musculoskeletal Institute in Charlotte, North Carolina, and mainly serves as the Chief Surgical Officer of Atrium Health, Greater Charlotte region, where he has responsibilities for perioperative services involving 18 hospitals and ambulatory surgery centers, over 140 operating suites, and approximately 12,000 procedures a month. It is my pleasure to welcome him today. Welcome, Jeff.
My pleasure to be here, Steve.
So, Jeff, it's a real privilege because we know each other really well, and he's been not just a friend but a mentor to me. And I think when I talk about him, I think this will resonate and come across to this to the listeners today. One of his superpowers is that he's a maven, and really so much as in terms of not just being an expert in multiple things, but he understands how to connect people. But I'd like to start this a little bit broader with you, Jeff. We talk about this periodically, and I've heard you speak on this. And I think you have somewhat of an undercurrent of frustration about the lack of surgeon leaders, certainly as you look at the landscape of our large organization. And so I guess my first question for you to bring forth is why surgeon leaders? Why do we need surgeon leaders?
Yeah, that's a great question, Steve. I think that everyone that's on as an audience understands that, as surgeons, surgeons solve problems. We're very problem-solving oriented people. And I think that we also understand that we know what needs to be done. We know who can get it done for real. And that we also know that surgeons tend to follow other surgeons in leadership. We trust one another. There's gravitas, listening to a surgical leader. And so then you have to ask yourself, if we don't have surgeons stepping into a leadership role in medicine, then who's going to step in there? Are we going to continue to only listen to non-clinicians? I mean, really? Are we going to continue to listen to non-surgeons? That's where a lot of our frustration comes from, with people that don't understand our space. They don't understand our cadence and our rhythm. So, I view this as, step up or face the consequences.
What do you find that's really innate about surgeons that make us fit for this job? Because there are physician leaders in any organization, in particular in any large organization. But what's innate about surgeons that makes us a good fit?
Yeah, I think it's the timeliness of decision making and the willingness to accept risk. In my experience, as a generalization, working with some other specialists and certainly with a great number of hospital administrators, is they are risk adverse, or they don't understand how to manage timely balance of risk, even if it's severe risk. Whereas we, on a day-to-day basis, you're working up against the cava, you're dissecting off the ureter, you're talking to people about metastatic disease, every day. And so, if we can manage those types of conversations, that type of balance, I think the administrative decisions come a lot easier to us.
And then when you give me some framing around your mentality as a surgeon leader. You know, I know you talked about a few of the things that you think make us situated well to be surgeon leaders, but in general, what is your mentality as a surgeon leader?
So a couple of things. One is, what's your true north? I think, if your true north is, you got into medicine because you wanted to help people. Yeah, I think if you have to understand that, as a leader, you get to help other people help their people. So, when I do my job as a force amplifier for my friends who are and colleagues who are surgeons, I can help make decisions that'll influence 1,000 patients at a time, sometimes, as opposed to one patient at a time. So that's one thing. And I think the other thing is we also understand teamwork, because we have to work on a team. So whether it's our scrub team or whether like in cancer where we have our multidisciplinary team, we understand that it's a collaborative nature, but we're accountable for the endpoint, which again I think separates us out as surgeons, because in the OR we are ultimately accountable for the endpoint, but we have an awful lot of people that do things that we don't know how to do, like anesthesia or circulating nurse or whatever.
Can you think of things that, as a surgeon, at least from your perspective, that you've had to overcome that were a blind spot to you that maybe are not a blind spot to other physician leaders?
Yeah, first of all, I'll answer that in saying that, you evolve as a leader. You evolve through your career phases. When you come out of training and then you go into your mid-career and then into your late career. So that's the first thing, is you do evolve and you learn, and you have to grow your EQ to be sensitive. And so I had to learn to actually ask people questions about things as opposed to trying to overly direct things. So if reaching a point of decision or a point of impasse is like, I learned to use the phrase, help me understand, help me understand, why we can't get there. Help me understand, what the impediment is, as opposed to just making an assumption, which again, in the OR, when you're directing traffic, you're directing traffic. So you every time you reach a pivot point, you decide what part of the dissection comes next, what part of the ligation comes next, what part of the procedure comes next. And it's a little bit more collaborative and nuanced, I think, in leadership.
Yeah, I love that. Help me understand. We've heard this before from other people on this podcast. Just the concept of remaining curious, or maybe being over curious as a strategy in leadership, and certainly that question fits in that mold. What in your journey shaped you and shaped your current perspective? Because I think one thing for this audience that they don't know about you that is certainly, as we unpack your knowledge and your experiences, you're now towards the end of your career looking back and have a lot of sage wisdom to impart. And in part, that's been shaped by your journey, not just when you were young, but throughout the course of time. So what is it that shaped your journey and your perspective?
Yeah, I would say, at this point in my career, one of the things that I'd like to share is that when you're making decisions as a leader, there are consequences of those individual decisions. But if you're really trying to be a super leader, what you look at is, can I help make decisions that are foundational first? Then, if those things are foundational decisions, then can I sequence those? So now I'm sequential, which means I can now scale a good decision. And then if I can then do that, then now I have a durable solution as opposed to having a one-off solution. And so, my thinking evolved as I grew through layers of decision making, at a lower level to a higher level. And I think helping others understand that that's where you're trying to get to with an individual decision. It's like, let's just not have a Band-Aid. Let's get to something that, again, I can sequence, I can scale, which also means having a process that others can share, templates that others can share. You start to understand that you're really helping them do their work better. And if you're helping them do their work better, then the outcomes are good for everyone. So I think, I think that's a good short summary to your question.
So let's unpack that maybe a little more, because I think that's actually really important what you just said here. So this is what I hear, but help add some clarity to this. I hear you've established an envisioned state, but you've given a roadmap to how to do that, and the concept of creating decisions that are foundational, and then when they're foundational, then you're able to scale those and they're durable. Can you give an example? Can you lead us in a little bit more into that? Give us an example.
I'll give a great example. So I serendipitously wound up being the head of the cancer center here one day when I walked into a meeting and the cancer center director had resigned, and the CEO said, Dr. Kneisl, you're the new cancer center director, without interviewing me or asking me. And I said, I have a full-time job. He goes, that's okay, it'll be temporary. Well, 11 years later, my temporary job ended. And so during that time, we were at the beginning here, we were a single hospital cancer center. And what we wanted to do is we wanted to go ahead and scale that to the other hospitals that were in the greater Charlotte region, ultimately being 8. And the way we did that, was the foundational principles were the Commission on Cancer standards. So that was the foundational principles that we had to get everybody to accept. They also had to accept the fact that they didn't have the ability to meet all of those standards, but we could scale those standards to them if they were just willing to be accountable for meeting those standards. So, we didn't have to over-resource some of the other smaller hospitals. We just resourced particular items to them. It raised the quality of care at that hospital, which was wonderful. And so then in order to make that durable, because they're now able to take care of some of the lower level cancers at the beginning and then ultimately want to get at the higher level cancers, well, now they're able to attract better talent, because if you have an infrastructure there, it's easier to attract a young cancer physician to go out, to the suburbs and everything, because they don't feel like they're living in isolation. So now we have gone ahead and gone from scalable to durable, because now I have a critical mass of those specialists that are out there, and so now I can bring in higher acuity cancer specialists. And Steve, I mean, the people that are listening don't know this, but I was also the cancer committee chair for 20-something years here, and Steve actually took over that job from me several years ago to help run our cancer network. And so I know that Steve understands this intuitively.
I've heard you comment before in this kind of looking back at this career path phases. I'd like for you to touch on that for the audience, and kind of how you've thought about that and realize that not just in the moment, but looking back, and how who you are and what's important to you may change, but maybe from a little bit different perspective. And then the other thing that I'd like you to touch on is just, you're big on values and your true north and making decisions around your value system. So can you lead me into both of those?
Wow, those are big questions. So yeah, I mean, the career phase thing, I mean, the short description is, I've read and I view, the career, you have your developmental phase, which for us was medical school and residency. And then you get into the crescendo phase of building your personal expertise, which I think takes probably 5 to 7 years after fellowship to get to where you really are, operating at a very, very high level. And then you maintain that until you get the later career, which you then devolve based on skill sets and other things. And so, you need to be purposeful about what your evolution looks like, which means you've got to pick your direction, your true north, where are you going, as the statement goes, and then how are you going to get there, which means, you've got to develop toolboxes along the way. And that means for people that didn't train in robots, in my generation, they had to learn how to do robots, or arthroscopy or whatever. And then towards the end of the career, you have to decide, well, who are you going to be? Are you going to be that mentor, or are you going to be that helpful person, that facilitative leader, or are you going to be the alternative, which is what I call the gray ceiling, which is the guy that doesn't get out of the way, kind of stuck in the old ways, maybe very powerful politically, but really is not maintaining a legacy and building that durability into the practice or into the program or into the department, and actually could be a real downer because they fundamentally won't get out of the way. So I mean, I think that's my answer to the first question. That could segue into the next one. Yeah. So then again, the true north part is, you got to figure out, who you are and, what you're doing. And, fundamentally, I knew, I grew up in a military family. It was very service oriented. I didn't hear the word servant leader for a long time, maybe not until after I got out of med school, but I think ultimately, if you're focused on something bigger than yourself, and I think many of us in medicine are, then you have to sit there and say, well, how can I best utilize my talents to help more than one patient at a time? And I think that's why you start getting involved in programmatic decisions, programmatic leadership. And many people get involved in academics for that reason. They want to have an impact because they're going to write an article that's going to impact practice beyond just their own, beyond their own practice. For me, working the people that I like to work with, and I have to have a lot of trust with people. I like people that have the same phenotype. I like to help people develop. I really like to help people develop in their careers. I get a lot of joy, out of that. And I don't want to be that gray ceiling. I want to leave lieutenants behind who know how to do it better, faster, have better ideas.
If someone were to ask about your values, what are they for you? Like, how do you make decisions? Because I know I've had conversations with you before about this. Like, do you have certain principles that say, hey, these are kind of the core nuts and bolts of how I make decisions, or my value system around decision making?
Yeah, I mean, I'm sure that we all do. I mean, first and foremost, we're talking about patient care. If it's patient first. I live in the business side a lot now in medicine, but I'm always about, look, we make very good decisions about taking care of the patients. And taking care of the people who take care of the patients, the revenue will absolutely follow. And I think that is a very strong fundamental for me. And as a clinical voice in the boardroom, it's a very important voice for people that have never taken care of a patient, never been at the bedside, and frankly are used to being first in line every time they show up to the doctor because they happen to be a boardroom member, and they don't really understand what it's like for anybody else to have to wait for a scan or an MRI or for an OR time. So I think that I would say that probably, for the purpose of today, is one of the most important core values. I would leave with that.
I know you've thought a lot about how you got to where you are. How do you prepare? How did you prepare for your future? What do you recommend to people how they prepare for the future? And then I think probably second level of that, I would assume that the listeners and other people that you come in contact with question themselves as a leader, a surgeon leader, because they're not quite sure how to get taken seriously, or they at least struggle with the concept to get taken seriously. So first question, how did you prepare for your future, or how do you recommend one prepares for their future? And then two, what advice would you give to budding surgeon leaders or current surgeon leaders about how to get taken seriously?
Yeah, it's funny. I think I've gotten almost every one of my leadership jobs by being willing to step into a vacuum, run into the gunfire, say yes in the face of a challenge. Getting back to where we started, with the belief that if it's not one of us who's going to step in, then we have to face the consequences of not having one of us. And I mean, we're all busy people, but I think that the willingness to step into that space and embrace that space, what you find is then you get recognized as really, as being a meaningful contributor by people who understand that they can't do it. And then the next thing happens, and you get asked to do the next thing, which actually might be, a little bit more enjoyable. Also might help your career a little bit more. And then you get to the point where I'm at, which, have people asking you all the time to help out, across the entire enterprise, just because all they want is to be helped. That's all, And so, how can I help you is one of my favorite phrases because it's very genuine. That's exactly what I want to do. I want to be helpful, and people understand that you're going to do that. You're not trying to build an empire. You're not trying to take over power. You're just trying to help them out. I think that you'll have more than apt opportunities.
Yeah, I also will say I watch you. The other superpower I think you have that I've seen is just your preparation. And if there's anything that I've learned that I think would also be in a small snippet valuable for this group is, without a doubt, when you go into a meeting or you take on a new initiative, you do a lot of homework, a lot of preparation, a lot of thought, a lot of asking opinion. So you don't come in there cold turkey. And I do think, and I guess my question is, and more so in this comment is, I do find surgeons, we are really busy. We got a lot going on, both clinically, but that includes the operating room. And we tend to run at this fast pace, but sometimes the best way we can be successful outside of the operative suite or out of the clinic is just our preparation before we get into these quote meetings or situations.
Yeah, so that's great, Steve. That's a great observation. So if you think back to your training, when you were a junior resident, most of us, we didn't come out as some genius that just knew how to operate. We spent a lot of time as an intern and junior resident reading anatomy, reading the technique, watching videos, and so that is called preparation. That's called process. What you do is you take for granted when you get out into practice, because now you can just do it, like throwing a baseball. You don't think about throwing a baseball anymore because you learned how to do it as a kid. Well, getting into the administrative realm, this isn't your realm necessarily, unless you have a lot of experience along the way, in which I was fortunate to get a lot of experience in the military, and in my upbringing and in some other organizations I belong to. But if you didn't get it, you have to fall back on the fact that I'm a learner. I need to have a process. I absolutely need to show up to be prepared, or I'm not going to be taken seriously. And the worst thing that can happen is to show up as an accomplished physician and not take the other guy's business seriously. So the administrators, they take their business seriously. They may do it differently, but they take it very seriously. So if you come in just shooting your mouth off the top of your head without thinking through what the problem is and what the solution is, and getting back to what's a foundational solution, what's a scalable solution, and if you show up with those types of answers and thoughtfulness, they'll be shocked, because they're used to having a reactive surgeon, which is the reason that most surgeons show up, is they're pissed off that something bad happened to them personally, and that's the only thing they want to have solved. So if you show up with a whole different mindset, with an understanding, because you've done your homework, which is so easy to do now with, the internet and Google, and just, the little connective tissue that you build. You can really wow people. They're going to take you seriously very quickly.
I love that. I just like to highlight that again, showing up not as a reactive individual, or in this case, a reactive surgeon who's coming in with a complaint, or is showing up because they feel that they have been personally wronged or personally affected. Is just showing up as a receptive individual, looking for the opportunity to help in spaces that need help.
Right. Because we're problem solvers. That most of the time we're showing up because we've identified that there's an element of a problem, and because you're a good problem solver, if you can eliminate the emotion or the reactivity, and actually that's how I help a lot of my colleagues too, who have really good ideas, but they're hot. So I said, okay, let's get off the reason why they're hot, and let them get through the emotion, and then say, okay, what's the good idea that you have, and why wasn't that implemented? And you've participated in many of those solutions here, Steve, so you understand how that works.
You talk about surgical solutions being healthcare solutions or system solutions. Can you tell me more about this, or tell us more about that?
Yeah, well, so I'll give you another example of work that I participated in here, which is surgical redistribution. So in our environment, we have more demand than we have access. In our called big house here at Carolinas Medical Center, Maine, it's about 1,000-bed campus. And, this is where we do the tertiary quaternary care, but we're also a community hospital. And for the longest time, we had a hard time having the surgeons that work here moving, the low acuity stuff out and the outpatient stuff out to make room for the higher acuity things. So we had to go ahead and pull together the service line leaders as well as the market leaders, as well as the facility leaders, and come to an understanding of like, well, where are these patients coming from? If they're coming from outside of Charlotte, and there's 4,000 of them, and we can take care of them at a hospital 10 miles away, and that makes more room for things like transplant and high acuity cancer and high acuity cardiac and more robots, then ultimately it makes sense. And it also makes sense because the length of stay goes down, because if you fill up the OR with things that don't have to be here, because we have 35 or 40% of our patients are coming in via transport or a helicopter, and then they're waiting in a bed to get to the OR while somebody else walks in the front door to have an outpatient surgery. Well, that doesn't make any sense. So, again, facilitating those decisions, at a higher level between departments and divisions, that was a big ask, but we've done that kind of work over the last 5 to 7 years. So, and we dropped our outpatient surgery rate in the adult main OR from maybe 40% down to like 17%, which made a lot of room for other things that could only be done here.
What tactics do you think of in small environments versus that for large scale change? I mean, do you look at that differently, like what you're doing in a microenvironment versus what you're doing in a large scale?
Yeah, I'd like this conversation. I talk about federal rights and states' rights. So federal rights, like now where I'm at now, actually I'm the feds, where we set the big guidelines, the big boundaries. Think of like a horse track, with what the guardrails are, and then the states are like the horses, and they understand their own microclimates very, very much, and they are smart, intelligent people and they want to run. So our job is just to make sure that they understand the direction, and we help provide them with some food and let them run, and so that we can go ahead and harmonize things in smaller environments. We also have to help them understand, where True North is and why their contribution is important to True North. So we get into we talk about horse types. Steve and I, you want to have that conversation about the different kind of horse types, but some people think that they're going to be a racehorse versus a workhorse, and it's up to you to kind of decide as a leader, like, what category are we asking them to be? So we said mutually understandable and transparent expectations. That's a whole nother topic. With surgeons, surgeons get very unhappy if there's unmet expectations. And so if you're not transparent about what's realistic with them, whether it's block time, equipment, pay, anything, they get very, very unhappy. The flip side is if you're very transparent about it and honest, that creates trust. And even though they may not be completely satisfied with the answer, they'll be very accepting of the answer, because that's kind of how we make decisions. We're not happy with complications, but we have them. We're not happy when we don't have a great outcome, but hey, I'm a cancer surgeon. I don't always have great outcomes, even if this patient has uncomplicated surgery. I mean, there's a natural history of the disease that we all have to accept. And so I think in the surgical mind, we can accept less than ideal outcomes as long as there's some transparency there and the expectations weren't set unrealistically, or even worse, without total trust. I mean, I think that's a huge flaw. As a leader, you can't be accused of not being trustworthy, not being reliable, not being transparent.
You talk about developing others being critical to your success, and how maybe some people don't look at it that way, or maybe feel threatened by having a really strong people around you. I know you align with it, trying to find really strong people to work with, that work underneath you. Can you expand on that?
Yeah, I mean, only as you've got to as successful as your team can be successful. So other than identifying good talent, being able to attract good talent, I mean, you have got to show people that you really care about them. You care about their development. You not just care about their particular output. Again, we're working with highly intelligent, highly motivated individuals in healthcare. whether they're nurses or physicians or APPs. So, I mean, different than perhaps in some other jobs. And so you just have to realize that a little bit of love and attention, sincerely given, does actually have a very, very high return. And the other thing is everyone on this call, someone's going to have to take care of you someday. So it's not just going to be you taking care of you. So if you don't go ahead and elevate the people around you so they can take care of others, who's going to be around to take care of you?
Can you give us a little bit of insight into your perspective on the way you look at coaching, mentors, proteges?
Yeah, that's part of the whole package. There is, when you sit there and say, picking your direction in life, what's your vision, how are you going to get there, building your personal toolbox of skills, and then who you taking along with you, who you take along with you on your journey. And so, your coaches and your mentors, also your proteges become, reverse mentees over time. And so, maintaining those relationships, and there's a whole host of different ones, whether they're the master, of their craft, whether they're the person that you use as a confidant, whether they're the person that actually is maybe your sponsor. There are different types of coaches, just like for people who played sports. You have a position coach, you have you have your whole offensive defensive coordinator coach, and then you have the head coach. Each one of those have a different role, and understanding that each one of those can be important. And most of those people really enjoy doing it. So if you show some interest, back, you maintain those relationships over time. They're extraordinarily valuable.
Well, Jeff, thank you so much for sharing your time and expertise with us today. I'll certainly give you any final thoughts around the concept of dynamic leadership for our audience.
Yeah, thanks, Steve, for the opportunity. I would just encourage everybody to, take a dare. Take a dare. I said earlier, show you care. My other phrase is, take a dare. Just be willing to take that leap of faith. I think you'll be surprised what you can accomplish. And I will say, as your career matures, it is a very fulfilling step to take.
Take a dare. I love it. And thank you to this audience for joining us on the AUA Leadership and Business Podcast. Until next time, continue to learn, lead, and excel. Thank you.
Thank you for listening. If you enjoyed this episode, make AUA Leadership and Business your go-to podcast. Subscribe today by searching AUA Leadership and Business on your favorite podcast app and enhance your leadership and business education needs.